Hundreds of people greeted Jacinda Ardern in Dunedin today as she pledged that the city would get a new $1.4 billion hospital in the first term of a Labour government. National has promised to rebuild Dunedin Hospital within 7 to 10 years, possibly through a public-private partnership. But Ms Ardern says building Dunedin's new hospital with a public-private partnership will only delay the project.
Yeah, the commitment we've made is yes, we would like to start the build in our first term. The promise was made that this work would begin back in 2014. It hasn't. We now have a situation with Dunedin Hospital where operations are cancelled essentially when it rains because of leaking. It is urgent work. There are many reasons why we're opposed to a PPP, one of which is we've seen examples abroad where hospitals built under a PPP, particularly in the UK, have led to blowouts and poor service. We've even got examples in New Zealand. Our view is it would also delay the delivery of the hospital, which is absolutely critical for Dunedin.
So it'll all be publicly funded, and how quickly will it be built and be open?
Look, our expectation is that it would be that we would start in our first term, and then our expectation, based on what we've seen of other similar projects, they've tended to be built, within 5 to 6 years. We, of course, once we develop up the plan, will have a firmer timeline, but our view is that it certainly can be delivered earlier than 10 years.
Why so urgent? I mean, you've been on a tour of the hospital today. What have you seen that you think it needs to be done so quickly?
Well, of course, other than the fact that we have surgeries been cancelled because of the leaks in the building, there's also the fact that maintenance has been delayed because it's been called uneconomic to continue with the maintenance program, and there's even questions about seismic risk. There's a range of reasons it needs to be fixed. Look, from what I saw today, there's exceptional service being provided by staff, but the plea is just making sure they've got a hospital that is fit for purpose and can deliver for the 300,000 people who in this region rely on their hospital.
Did you go through the emergency department? Because we've had reports that it's absolutely chocker.
Yeah, certainly the ward that I visited today was full, but we of course wanted to make sure we didn't cause too much disruption to the work that the professionals are trying to do there, but certainly appeared from what I thought to be pretty full.
And your plans for building it where? Not the Waikari site?
Yes, no, we've said not the Waikari site. It is out of the city. Our view is that the commitment to a central city site really is critical. A collaborative project that allows the university to still use the hospital in the way that it's able to now will be key to it being continuing to a place of learning and hopefully, as we've seen with the dental school, world leading. When I visited the hospital today, the number of students who came and talked to me while I was there, it's clearly very, very linked to the university, and a central city site is key to maintaining that.
So any thoughts on where that site would be? I mean, I think there's talk of taking over the old Cadbury factory site.
But there's been talk about a range of sites. We wouldn't want to get too far ahead of ourselves in case we reveal too much, when obviously we're going to be in a position of having to negotiate down the track. But the government's already indicated that their view would be a central city site would be preferable. They haven't ruled out, though, going out of the city. That indicates to us that there's certainly a range of options that are on the table and very, very viable.
So National is saying it could build the hospital within 7 to 10 years. You're saying that it could be built sooner.
Our view is sooner. Our view is that from what we understand of the project, that the PPP is potentially a considerable part of the delay. The amount of contractual work and the contracting process around that kind of set up certainly would only delay the project. We believe we can shorten the time, both by committing to doing it earlier, but also changing the nature of the project.
And that's the Labour leader Jacinda Ardern.